So, first I always start off with questions that you have.
Well,
Okay, well, how long is the surgery and what type of anesthesia is she going to have?
On all spine that we do, most of them are general anesthesia, completely put to sleep.
Okay, so she will have
So I have
an
to-
apparatus breathing for her.
Absolutely.
Okay.
So they told me I have to call Long Island Community Hospital, which is, you know, the old Brookhaven,
Okay, for the
to
anesthesia record.
to get Dr. Mangiamelli's records
Okay.
of anesthesia, and then I'll have it sent over here for fax.
Okay.
Mhm.
Yeah, definitely general anesthesia for something like this.
Mhm.
So why we're doing this is you can see this disc space right here
Mhm.
is asymmetric.
Mhm.
In order to make this disc space look like this one, that's the anterior component to it. Meaning we have to put that space, this one needs to be recreated like that.
Mhm.
Titanium 3D printed cage gets placed in that position. And then from the back, you have to support this with screws. With you, I think we can do it across one space just like that.
So the 3D printed, that's the implant.
Yep, that goes from the front.
Okay.
And that's going to recreate this right here.
Yeah.
Okay.
Okay.
Will you only be going in through her back, or will she have tubes from her sides and front?
Also go from the back also. To put the screws in, we'll do the screws in from the back.
Mhm.
Why I would recommend reinforcing it, you have a construct up front that's gonna be screwed together, and then screw it together from the back, so now you have screws in this orientation, which biplanar screws are much stronger. Why we try to overbuild things, particularly superimposed on top of you, is the demands that you're gonna require out of this whole thing. So I think overbuilding this thing increases your chance of fusion, increases your statistical chance of getting back to doing whatever I want to do after healing process.
Okay. Drains, I'll have drains, you said?
Yes, one from the front.
Okay, from the chest.
Yeah, because this is gonna be, going from the chest, yeah, there'll be a chest tube. Yeah,
And how
so
many
big
hours
unit.
do you think I'll be under?
Something like this, by 5 to 6 total. There's a lot of setup time, so once you put to sleep, it's not like, oh, we can start working. No, there is a good 40 minutes of positioning, both sections, almost an hour and a half of that is just spent positioning you right side up, depending on the thoracic surgeon getting in from the front, so I can get a cage in from the side, I think would be the best option on something like this. And why we do that, going from the side, I can put a cage in that's literally the size of my thumb. If I go from the back, which is another option, I mean, there's always options on what we're gonna do. So if I'm gonna tackle this from the back, I only can put a cage in, I can't touch your spinal cord. I have to work over here. So I can put in a cage at this angle here, and then another one over here. Those cages are about the size of the tip of my pinky. If I can put in something bigger with a high demand patient, I think, yes, it's an extra set of a procedure, I mean, I gotta go from the front, but I think structural stability for you, I think you're better off going from the front, putting something bigger.
Those drains,
Okay.
how long will those drains be in her, and how often do they have to be changed?
Check all the drains, probably about 2 days. And then come
So
out.
those drains will come out before she
You're
leaves the
not going home
hospital?
with any drains.
Oh, okay.
No drains.
That's, you see where I'm going
I
with
know,
this?
No,
I'm
no
used to them
drains.
with the mastectomy, but
Yeah, they're in
that
for
was
a long
that
time.
hit my nerve, and I was like, ugh.
No, these are out within 2 days. You're not going home with drains. You're not going home with any of that stuff.
Great.
You're going home when you're functionally capable of being independent. I mean, yes, minimal assist. I can get up by myself, just someone grabbing my hands, helping me up, things like that. That usually goes 3 days. Going from the side, yeah, it's a bigger procedure.
Yeah.
But I think long-term stability, meaning I don't want to come back and do this again, go from the front and overbuild this thing.
So she won't need
So
any,
not,
I'm sorry,
I'm sorry, not a incision on the side?
Yes.
Oh, yes, incision on the side. Oh, okay, but you'll go through like the inside to go through the front.
Yeah, when we go from the side, it's gonna be up higher. This is like L4-5, your pelvis. You're gonna be like, that's your 12th rib, 11, 10. You're gonna be like probably like right here.
Okay.
It's our exposure surgeon. I like going from the left, I like operating around the aorta. The vascular surgeon, that's who opening your chest, he's responsible for that. Sometimes they like going from the right, that's just their preference. It doesn't matter to me, left, right, it doesn't make a difference. It's not like, oh, we need different gauges. So left,
Well, if you
right.
go from the left, whatever post-surgical pain she's gonna have will be better because she's right-handed.
Yeah.
So for basic things like self-care,
Exactly.
it's, yeah.
Rib pain, intercostal pain, going from that side, you know, you'll have it, but incision about that big, like literally in between ribs. Okay.
So she won't need any kind of acute rehab after this?
No.
Just some, will we be getting,
Acute rehab meaning, oh, I had to go to a nurse, like rehab facility?
Yeah.
No. They will present it to you, we consult them. They would love to have you in rehab, but just given your body mass, your history, your type A personality that has enabled you to accomplish everything, no, you're going home. If I can get someone home, you're going home. And I think that you're going home with this.
Yeah, because they're really like the hospital.
But
and
it's
just
an
leaving
option,
her
God
for
for-
infection. They
Yeah,
just
you
want
don't
you
want
out.
to be there.
Yeah.
No.
Yeah, but it's an option, God forbid shit hits the fan.
Oh, you get held up for a couple days and hey, listen, I'm not rebounding as I say. I thought, yes, we always have things in our back pocket.
Okay.
But 2 or 3 days in the hospital, but hey, if I have to hold on to you for 5 days, and you say, yeah, every day I'm getting better, I'm sitting up in the chair, I'm walking down the hall, I'm feeling better, I'm getting close to, I can do this at home with minimal assistance. When I say minimal assistance, meaning, yes, all right,
Well,
come on,
she's
get
gonna
up out
come-
of bed, boom, get up, you're
She's-
walking with me.
She's
I
coming
can-
home with me
Yep.
at my house for at least 3, 4, 5 days in that range.
Yeah.
Because I don't want to send her home alone. We've got Bubba already in boarding for up till the 22nd. So
Yeah.
she needs to have, and I need to set up her house for her.
Yeah.
I don't mean to be
Yeah.
your grill, but you know what? You need a
We're
mom.
doing that.
Yeah, you know, your age and your body mass and your core strength.
Yeah.
No, I'm not gonna
Which
do too
I'm
much.
losing. Which I'm losing profoundly.
That's
Goes
okay
quick.
because you're gonna come back
Crazy.
stronger.
I know.
Yeah, goes
Like I'm
fast.
like doing things and now this finger started
Mhm.
last week, you know, just like the nerves and you know, there's the twitching and stuff like that. This calf now is getting the radiating heat also, not just this
Yeah.
one. And just everything, just because I'm not taking the anti-inflammatories anymore. My hips are locking up like crazy, getting that iliopsoas syndrome, like the pop when I stand
Yeah.
up because they're locking. So you think, you know, as this fuses together, the spine shape will shape into a regular spine.
Oh, the day of surgery, this is gonna look like this.
And then I'll get the curve back.
This whole section is gonna be pushed here, and you'll get that curve up top a little bit more. Right now, you're based on
That's what I-
dramatizing
no,
it,
you're not.
but you're like this.
I know, and
You're-
that's why I'm
you're walking like
trying
this.
so hard to stand upright, and I've
You're
sent
not.
it to multiple people.
Dorina, it's like my
Like I
knees.
am carrying you, like on my
You're
back, and
not.
I'm leaning forward like that, and I try so hard all day to keep this, because and I would say for years, it just feels so much better if I could walk around like this all day. No wonder why, because that's the shape my spine is.
Yeah, you
It
just
is,
sort of,
but I'm trying so hard.
Yeah, he'll straighten it out. Remember how my knees were
Oh gosh,
buckled
you're so
before
bold.
I had my knees
So
done?
she had her two knees replaced, her hip replaced, and I prehabbed her and post-habbed her, and she lost 140 pounds.
Will she need at-home physical therapy, occupational therapy, nurse? Because I know when I came home, they had Catholic Health come in with a nurse,
yeah,
PT, OT.
yes and no. Why I say that, home PT, in my experience, is super lackluster. And for someone, I keep referring to your past, your career, to have someone come in the house and be like, okay, we're gonna do physical therapy, and move your arms.
Yeah, I know.
You're gonna do something, you're like,
Well, I was
"Are you
thinking-
kidding me?"
I know.
Well, I was thinking more directly post-op, like
Yeah.
the week she comes
I
home.
No, I always will purposely wait about 3 weeks. And why 3 weeks? Most times incisions are completely healed at 3 weeks. I think using your past, I think just light gym workouts are going to be your physical therapy.
But she'll get
I-
some physical therapy in the hospital post-surgery.
They're
in
just
order
going to
to-
be walking you down the hall.
Yeah.
Okay.
Just independence, walking up and down the
Yeah.
hall. I think sending you to physical therapy,
It's redundant.
very redundant, very below you, so to speak.
Yeah.
Soft tissue modalities, yeah, hey, I went to physical therapy, they're
Massage
inside my
after that.
gym, they're doing some heating pads and some stretching.
Yeah.
but I'm gonna go work out on my own. Yes, we can do that,
Mhm.
but I don't think we're gonna need it for,
So
to get me back on my feet.
yeah.
No.
I found paperwork, copyright 1992,
Okay.
of paperwork that they would give you in physical therapy of all the cervical exercises and
Yeah.
lumbar exercises. That's when my first back injury happened.
Yeah, we can give
And I'm
you
like,
the newer stuff, but-
1992. Wow.
Yeah, they'll
that's
give
like
you.
crazy.
They're gonna send you home with some.
Well, I know,
my
but saying,
sister-in-law
like-
just had this surgery, so
Yeah.
that's where my question is.
But saying
But
like
she's
12
65.
years old, 12 years old was my first spine injury in my neck, and remember I had like my
Mhm.
spine, I have it on video of me like curling over like that, and then I was in a back brace for 3 months.
Okay.
And then when I came back, I was working out on a fractured ankle for
Mhm.
3 months and then broke it again.
Gymnasts.
Tore a ligament, sprained it, 13 years old, had reconstructive surgery, can't even see that, no arthritis in this knee ankle, because I quit right after that. I was like, I'm done. My back is hurting, my ankle is hurting, and then years later I had my knee done with a torn meniscus and 2 cysts, and then this done, and then that made everything in my back like, and then that was it, triggered it.
Yeah.
Should she be not smoking any pot a week before surgery, 2 weeks before surgery, anything like that?
Well, yes, he can stop that. Definitely tell the anesthesia department you stop that.
Yeah.
If you can, yeah, slow it down a little bit.
Because I know for me it was they wanted me to stop smoking pot
Yeah.
because it was too much of a blood thinner.
For me, it's not going to change my day at all. It's just when an anesthesiologist is putting you to sleep, they want no additional substances. Meaning, God forbid that marijuana you purchased has something else in it to make it more powerful, whatever it may be. You don't know, anesthesia doesn't know, and all of a sudden we go to intubate you, now we have another funky reaction to it. The cleaner the slate is, it's easier for the anesthesiologist.
And that would go for alcohol, Tylenol, anything
Alcohol,
like
we typically say alcohol is a blood thinner.
Yeah.
So blood thinner and a pro-inflammatory agent, so if you can be off it 7 to 10 days before surgery, perfect. No anti-inflammatories, no aspirin, 7 to 10 days before surgery.
that. What about Tylenol?
Tylenol you can take.
Okay.
Marijuana, some anesthesiologists don't care at all. Some are pretty much sticklers with it. With your history of an adverse reaction to anesthesia, the cleaner your slate is, say, listen, I do smoke marijuana for pain relief, whatever it is, I have not smoked in more than, say, 7 to 10 days, perfect.
Okay.
And the she'll have pre-surgical testing at.
And Northwell does it
Northwell
all
on
through, it's up on Sunrise Highway.
Sunrise
You know
Highway.
the Kohl's shopping, not Kohl's
Yeah, I know
shopping
where it is.
center, Hobby Lobby, Kohl's
Yeah.
is in there.
Yeah.
It's in there. It's
Oh,
just
okay.
they keep it all under one roof.
Will your office
All-
coordinate that, or does she have to call
No,
prior?
they'll
And
get
how
it
prior
coordinated.
to surgery is the
About
pre-surgical?
a week.
Okay.
They do it all that way, just to keep, so all the tests are uniform, it's coming from the same position, it just sort of has that same reproducible thing to it.
And the CAT scan will show like
That's just giving me
inflammation and see
Nope.
what's,
I'm just using that as a blueprint.
okay.
Now, how big of an
Oh.
implant do I wanna use? I gotta measure up the CAT scan.
I have so I'm like, I told them all my doctors because this is probably like all my stomach issues is from this, so the GI had ordered me blood work and a CAT scan.
Okay.
So should I hold off on that, do this CAT scan and like wait till after surgery to get all this stuff done?
I don't
'Cause
have
maybe
that
it'll
much
fix
time
itself.
prior to surgery.
I know.
Yeah, I think one thing at a time, as long as you say, hey, listen, my GI thing is stable, I'm doing okay.
Yeah.
This is more just say my yearly or 2 yearly follow-up, I would say hold off on it.
Yeah.
If you say, no, I'm having an issue,
Yeah.
this is not right, then I would say that would sometimes even come before surgery, we got a little bit of a leeway on that. Okay, I think you can hold off on it, as
I
long as
think
you're
so.
okay, you're stable
Yeah.
with it, and,
Yeah. Yeah, there was more like diet changes,
yeah.
which I've made, and I think the GI, Dr. Sorby was just concerned because I've the twisted colon.
Mhm.
But maybe that will untwist itself as my spine goes back to normal. Maybe my stomach issues will go away.
So you find
Maybe after all this break, well, definitely my hips will be relieved.
Yeah, I think a
You
lot
know,
changes when you're, that little area of white signal inside your spinal cord right there, you see that?
Yeah.
A lot of things happen with that. That little white streak Why? Because every time you bend forward, your spinal cord is getting draped across this.
I get it sharp.
Sometimes you get it like into your legs.
Yeah, that.
What is that?
Uh-huh.
You're draping it. So in summary, why you want to do this to me, doctor? Your spinal cord is kinked over this bump. You have myelomalatial changes in your cord, which is a fancy word for spinal cord inflammation. You don't want your spinal cord damaged. So this whole thing listing forward, and you can see the difference in the disc space here and here. See how these are parallel? See how the front, this one is actually, it's sitting like that?
Yeah.
That's not gonna last you the rest of your life. At 44 years old, you got 45 years of using this damn thing. And I can't get you 45 years of rehab out of that.
Yeah, and you don't wanna have this surgery in your 60s like my sister-in-law. That did not, this has been a horrible recovery for her.
3 weeks not moving.
No, by the time you're in your 60s, you'd be paralyzed anyway. So you'd
Oh, that's
eventually.
good, that's good news.
And how it would happen with this, if you, and I've had patients say, "No, you're crazy, doctor, I'm not doing this, you're just a surgeon, blah, blah, blah." Okay.
No, I went home that day and was like,
What will happen is.
I know I'm not crazy. I knew I
You're-
wasn't crazy.
No, you're clearly strong. Like, wow, like, man, my legs.
My legs are on fire. I ran up one
Climbing
flight
up
of
the
stairs.
stairs,
I know. I'm like, it's like I feel like a 5K I just
And you
ran.
just watch it stepwise decline. Hey, take you
Yeah.
3 years to get there. Be like, yeah, doc, and all of a sudden it's also weird, I'm walking off balance,
Yeah.
I
Yeah,
notice I'm
sliding
Well, I
wobbling.
reminded her a few months ago, she fell down the
I
2
know.
steps in front of her house.
Fell up.
Fell
I tripped
up.
over Bubba because he stopped,
And
turned
she-
around. I just
she's
couldn't
like a
get
cat.
my leg up.
I've never seen her do that, and she
I know.
chipped her tooth, and I was
You know, it
like, do you
happens
remember?
slowly, as I said last time, when we were wearing sneakers, we talked about the whole high heel thing.
Oh, I know.
People say, yeah, I've been wearing sneakers, all of a sudden I went to put on high heels, I'm like,
Oh, I have not been in
can't
heels.
walk, why can't I walk?
Well,
'Cause you use
actually,
balance.
no, you were so right. Oh my God. Remember I said at the wedding that we went to, like my ankle, like being on heels, my ankles are like super weak, and I now have strong ankles. But it was like I'm, my ankles by the end of the night, they're like caving like outward like that. I remember my back pain was just like, I don't know if it was the tension of your family or just my back because I'm in a pair of heels,
Italians, they do that. It's a very
Both,
tensive
maybe
group.
both, but yeah, I felt like, yeah, okay.
No, it can.
Every time I'm in heels, my ankles are like
She's
this.
probably had, the average person would have been much more pain and would have brought your attention to it,
years
Because
before.
Years
your
before.
motor strength
Yeah.
has been able to.
masking all of this.
Yeah. And
Yeah,
now I'm
mask
carrying
it.
my shoulder, now my
Mhm.
hip, like I'm never had shoulder and hip
Yep.
injuries or tightness.
Okay.
Not feeling like I can like straighten this leg because this
You're tight.
completely
Mhm.
is like feels like it's going to like pop out of my skin.
Mm-hmm.
Never had that.
And as I said, sometimes the vascular guy prefers to go from the right. Is there any issue with that? You don't
It's
mind?
my tattoo.
You would be 4, 12,
Oh, that feels good.
11.
And my psoas muscle goes from T12 all the way
You
down.
would
I've been
be-
doing a lot
your
of that.
incision would be right there.
Okay.
If they go from the right.
Mhm.
You'd miss that would probably be missed. We're kind of more here because your
Cool.
spine is
Isn't that cool?
like behind my thumb, like
Mhm.
that.
And
why
I'm
we do
sure
that
you-
gives us a direct
I'm
shot.
sure your incision is going to be so clean.
Yeah, look at this. I'm a good healer.
Yeah.
Can't see nothing. Even under here too.
You
Keep it
can't-
nice and
You couldn't even, can't even see my.
These we
yeah.
used. It's all dermabond. We do like kind of plastic surgical closures on these. We don't do
Yeah.
staples.
This is from
Okay,
Dr.
that was my
Staples-
last question.
Staples
'cause-
we
That was good.
railroad jacks.
Dr. Net did that. It's been good.
Okay.
Except if my shins are all touching bars.
Thank you, doctor, you answered all of my
Yes.
questions.
Oh, do you wanna show them the stuff that you have, as far as like what I'm gonna
Yeah, I might have
read?
gone a little overboard with
I know.
Amazon,
Things that you
thinking
need.
what she might need.
Going on YouTube a lot and looking at people saying like what, like 10 things to have, like, the sock
I got
bed and-
her, a shower chair, cause she has a huge
There you go.
walk-in shower.
Mhm.
I think that would probably be best. She's alone, so
And
she's,
it's
Yeah, it's good just to take that, like,
Yeah.
take a
So
breath
she's-
here and just
yeah.
sit.
Sit.
Sometimes
It
after surgery,
swivels.
it's just nice to like just sit there
And
and
just-
like have peace.
Yeah, I like to sit in the shower. I like to sit on the floor in the shower, but I'm not gonna be able to do that
gonna
for
be
a
able to do
while.
that for a little
And I
while.
just like
think
to
a
let it
shower
go.
chair is good.
I got
the
the-
surgery feels good because
Yeah.
first
Her
couple
toilet
days just let me feel
Yeah.
It's
good.
very low in her house.
Raised
So I got
toilet.
her
Right,
raised
okay.
toilet seat with handles, cause she's got nothing to grab on.
Yeah.
Her friggin' bathroom's bigger than my
Really
bathroom.
big. It's
Um,
nice. Got a jet tub. Well, the jet's just broke. apparently. So I asked my landlord, like, can we get the jets fixed? I have a nice big jacuzzi tub.
I put a
That's
hip
3
kit-
weeks. I just don't want any submerged.
I'm not gonna go on that, no, until this is all, and you give
At
me the
least 3
okay.
weeks.
But I do, in my recovery, when I'm
Yeah.
given the okay,
Just
I
for the
have a nice
skin
big
incisions to be healed.
I got her a total hip kit that included a shower brush, grabbers,
Yeah.
sock puller on it, because is that okay?
Well, she has a cane, she has a walker at her house also from like when she had
Maybe a
that.
cane, you're not gonna need a walker.
Okay.
They'll get you on a walker in the hospital, it's just more of a safety insurance
Yeah,
thing,
yeah.
just to be posted.
Yeah.
For you, a couple days into this thing, to be doing this is gonna be an anchor. You may feel more comfortable with it, and if
Yeah.
you say, I just feel more comfortable,
Maybe not leave
within a
it.
couple days, get rid of it. Why? Because you gotta try and walk with the
Lift it
thing,
up.
you're better off just using a cane and
Yeah.
doing that.
Okay, well, we don't have to get that, we have that for me.
Mhm.
She's gonna have a little trouble in the bathroom cleaning herself, after a bowel movement, so I got her one of those
Poopy wipers.
poopy wipers, is that okay?
What's a wiper thing?
I'm trying to
I'm
be
like,
a
no
lady
one-
here.
No one's going there.
Okay.
That's what it is.
I mean, the nurses, yes, but not, no.
Do you think of anything I might have missed for
No,
her?
it's more than enough. And there's also,
I got her
not sure
neck
if
pillow.
Jessica has reached out to, she does our spine education class. There's also a whole
Not
other
yet.
wave
Uh-huh.
of this stuff coming through to you.
Yeah, she's
Oh,
gonna
okay.
need those classes.
And not yet, I haven't.
She'll discuss what to expect, presenting to the hospital the day of surgery, all that kind of stuff. She'll walk you through all that kind of stuff.
And then as far as insurance, do they give, like, does my insurance include certain things that I'll be going home with? Like aftercare,
You can
that we don't
ask
have to get?
just that. Social work, they can answer that specifically for you.
Why don't we just, it's Prime Day, let me just order what I think we need, and then if there's anything that additional, okay?
Prime Day.
I think you
Amazon
are
Prime Day.
more than, you're good right now, all that stuff. Don't
Okay.
get too creative with that.
Yeah, I think that, you know what,
I got a body pillow
Yeah.
to hug.
well,
you
that's
know.
all the
We're gonna get a
niceties.
recliner today, cause I have a deep, low couch.
Yeah, her
Okay.
couch is
So
very
we
low.
got a recliner that, you know, I don't have to pull the handle like
Yep.
that.
I'm gonna set her up, because
Mhm.
I have to know that you're safe, and
Yeah.
with Bubba, I already went through her house and said, this has to move, this has to
Yeah.
move.
Mhm.
The social
handicap in the
planning
house.
is a huge part of this, and you
Yeah.
guys have already tackled it, so you're gonna do well.
Yeah, I
Okay.
think she's gonna do very well. Thank you.
Alrighty.
Thank
you, Doctor.
Sweetie,
Thank
you
you.
got it, guys. I'll see you
Alright,
soon.
see you soon.
Any questions, get in touch with us,
You
okay?
got
Okay,
it,
you
thank
got
you.
You're also recording, I didn't wanna say that shit, but, but I just said it now.